Hey, it's Dr. Lenny Roberts from Summit Spine and Wellness, and I'm here with Dr. Victoria Clement, who is the owner of Restore Physical Therapy, located in Manayunk on Leverington Avenue, inside the mills there. Dr. Clement, could you tell us a little bit more about who you are and what you do?
Sure. Like Dr. Lenny said, I'm Dr. Victoria Clement. I'm a physical therapist, and I started my career in orthopedics and found my way to pelvic health. So I work in the pelvic floor and work a lot with people that have bowel and bladder issues, pelvic pain, and then those who are pregnant and postpartum.
Awesome. And Dr. Clement was just sharing with me her plans for the weekend. She's got some exciting stuff going on. You mind sharing that?
Yes. So I'm actually a doula as well. I'm a trained doula. So one of my clients is going to labor soon. She's having a home birth, her third child, and I'm very blessed to be a part of that experience with her. So I'm on call this weekend.
Gotcha. Very, very cool. What an exciting thing to be a part of, for sure. I'm sure that that'll be a great experience. So as a physical therapist, we have some similarities in what we do and definitely some differences in what we do. And we're going to get together and share some of the things that we do and what you do and how we work together and how we have also shared patients in the past and cross refer. So with somebody comes in with a hip or a lumbar spine issue, what will be a typical plan of attack for you? And then I'll share some of the things that we do.
Perfect. So a lot of the time when I see a hip and a pelvic issue, lumbar spine, there's usually, in my eyes, an imbalance in the muscles within strength. There's nerve tension. There can be some myofascial tension in there. So what I'm evaluating when someone comes in, I'm looking at their abdominal tension, the tension around their organs. I do little mini tests on each spinal segment just to see how that's doing, because the mid back to low back refers into the pelvis. So that's something I need to cover. And then I'm looking at spine or muscle strength. So the rotators, the extensors, the muscles that let your hip go out and forward, like looking at all planes of motion. And then the thing that is a little bit different than what a traditional physical therapist does that I do is I look at this group of muscles right here. So this is the pelvic floor. So I assess these muscles as well because they play a key role in the pelvic stabilization, holding your organs up, keeping everything happy in the center of your body. And like I mentioned, they have a role in bowel and bladder issues, sexual health, and then pregnancy, postpartum. They're big group of muscles that we need to consider. A lot of the time, though, when I see a hip injury, it's a groin injury. So particularly with men, I'll see someone that has a groin injury that's kind of snowballed into those other things I mentioned, bowel, bladder, sexual health. So they're very like nervous and scared, like what's happening to me? Why are these functions not working? So that's where I kind of dive into the pelvic floor region. So we're seeing if there's tension, if there's weakness in the front versus the back, if things are clenching in the back, which usually is the case, and kind of loosening up those muscles in order for the hip and the lumbar spine to move optimally. I also do look at those other two regions in conjunction with that, but a lot of the time it's a pelvic floor tension issue if it's a groin thing that's not getting better.
Awesome. Very cool. Thanks for sharing. And that was a great model there to see the pelvic floor. Awesome. So for us, similar concept in trying to allow the individual to put pieces of their puzzle together. So one thing that we do that some chiropractors do, others don't, is an X-ray analysis and looking at hip alignment and symmetry, as well as also what we call motion analysis X-ray. So we see how the bones in the spine move when you move. So my model is not quite as cool as yours, but this would be an example of two vertebrae in the low back, two bones in the low back. So basic concept is brain sends messages through the spinal cord out through the nerves. So the nerves coming out of our lower back go into the areas that Dr. Victoria was just mentioning, the bowel, the bladder, the colon, the prostate in the males, the ovaries, the uterus in the females. So that constant nerve flow is vital in the connection between the brain and the rest of the body. So when we move, the bones in our spine should move. What can happen is from accidents, falls, sports injuries. The most common thing we're seeing nowadays is repetitive stress, people sitting on phones and computers and lousy posture. And what we look at is the full body mechanics and looking at how that upper cervical posture and the rounding internal rotation of the shoulders can load up the lower back and cause that to constantly be engaged and lock up. And the bones in the spine will get stuck. And instead of moving and functioning freely, we're going to put pressure on those nerves. The term in our world is called a subluxation. When the bone doesn't move and function properly, it causes pressure on the nerve. So that can lead to a variety of symptoms, pain, numbness, tingling, loss of strength, potentially no symptoms at all, but it's compromising that optimum flow from the brain to the body. So I'm going to try to show. Right. So this is an individual who came into our office on Wednesday of this week, and this is their lumbar spine. So basically, this is their hip bones here, and here's a line coming through the center of their lumbar spine. This is them bending over to their side. So if you see here is the ribs. They're bending over towards their left. So their back is against the screen facing us. So this is their right hip, this is their left hip, and they're bending over to the side. And that is showing us here that these bottom three bones in the low back are not moving and functioning like these bones up here. So this is what should be happening, where the center of these bones is spinning, and then this space here is coming together and this space is gapping apart. So that's what we look for, is an ideal motion on an x-ray where the person's bending over to their side. But this is what that person came in with. So that is an example of what we look for, and we'll make recommendations to try and actually get that mechanics back in, remove the pressure and tension in that nervous system, and allow the body to function more like this. So we do a lot of work with joint manipulation, as well as soft tissue is a big part of what we do, and potentially some spinal decompression if there's pressure on the disc, to try and create a negative pressure on the disc to try and unload that and restore proper motion mechanics back into the spine.
I've been told, I don't know if it was you or another chiropractor, but it makes a lot of sense. Like, chiropractors work a lot on the control system, which meaning like the spinal cord, where everything kind of originates and becomes like flows to the rest of the body. So I think that's a really cool detail about chiropractic that's important. That's very different from what I do, which is more of like the outer region. So like the muscles and the tissues and stuff, which they work on too. But I think it's really cool that you can tap into that nervous system.
It's definitely, obviously appreciate being on here with you and sharing what we do and how we work together. We've had mutual patients, and they've raved about you and what you do. And it's definitely, it's great to find out more. And I know that there's a lot of our patients that can benefit from what you do and your specialty and expertise. And that's why we're sharing this information. So very cool.
Yeah. Yes.
So Dr. Victoria, could you tell us more, again, your office name, website, and how folks get in touch with you?
My practice is called Restore Physical Therapy and Pelvic Health. I'm on Leverington Avenue in the Mill Studio. If anyone's familiar with Fire for Effect Athletics, I'm inside of their gym.
Great spot too, by the way.
Yeah. And I'm on Instagram as Restore the Floor Doc, and Facebook Restore Physical Therapy and Pelvic Health. If anyone needs to contact me, phone number is 267-209-0930.
Awesome. Thanks so much for sharing. And for those of you that might not know who we are, we're Summit Spine and Wellness, located at 8151 Ridge Avenue, summitspineandwellness.com. And we're on Instagram and Facebook under the same names. And our phone number is 215-487-2500. Dr. Victoria, anything else you'd like to share or say before we wrap up this soon?
No, I think that was great. And just remember, like, I always tell people this, if you're between like, should I go to PT, should I go to chiropractic? You can benefit from both. They're very complementary services.
Absolutely. Couldn't agree more. Thanks so much for sharing. Really appreciate your time.
Thank you. Thanks for having me on.
My pleasure.